You've been diagnosed with prostate cancer. If your diagnosis came as a result of a schedule of appropriate PSA testing, it's very likely the disease has been found early. This comes as a surprise to most men, and they're quite anxious at this point. Being told you have prostate cancer is a frightening message, carrying heavy baggage. The normal urge is to plunge into a crash course, to learn how to manage this unwelcome intrusion into your life. A crash course that you're unlikely to know how to handle objectively. So what to do? Stop, take a deep breath, step back a bit, and think carefully. It's extremely unusual that there's any need to rush to a decision. Most cancers have been sitting quietly in your prostate and growing for 10 to 15 years, with the most aggressive one developing over 10 or so years. So you haven't just gotten prostate cancer, you have just been diagnosed with prostate cancer that you've been living with for a long time. Likely your diagnosis has been made by biopsy performed by a urologist, an expert in surgical management of prostate cancer. It's extremely important for you to know that any cancer, low grade, intermediate, or high grade, can be successfully treated with surgery, augmented if need be by radiation, external beam radiation therapy, permanent radioactive seed placement, for example, brachytherapy, combined if indicated by external radiation, and proton therapy. In some cases, cryotherapy or a short course of focused radiation with the CyberKnife technology is chosen. Active surveillance is a very important option for management of low-risk cancer. It warrants serious consideration and discussion. Take your time. Learn about the treatment options available to you. You may want to consider several of these. In most situations, all of these are reasonable options. But for some men, their individual situations make a particular option the better choice. Nor do all options suit every man's emotional reaction to the diagnosis, nor his preferences. So what should you do? You do not need to become an instant expert. Instead, you need to have consultations with possibly several specialists who can describe their treatments and help you decide which treatment fits you best. In the process, you may well have consultation with a urological surgeon and possibly several radiation therapists, each skilled in a special type of radiation therapy. If your disease is more complex, you may want to have an option from a medical oncologist, which is what I am. It's important to be informed, but you don't need to do this alone. That's what the specialists are there for. This is a time for deliberation, since once treated, you cannot reverse the course. After stopping and thinking and gaining expert guidance, then take action. Most, not all, of the mental fuzz of anxiety and consternation will subside, but when you made a considered decision, you'll feel very comfortable. Then you can devote your energy to the goal of successful treatment and recovery. The outcome of therapy for this disease is generally excellent, very likely much better than you might have thought. With careful deliberation on your part and treatment by experts, you will be able to make this usually good outcome your outcome.